everyone, this is Dr. Liv with New Insight, and thank you so much for joining me in another video. Many people believe therapy is only for severe trauma, major mental illness, experiencing paranoia, psychopathy, or when someone is a danger to themselves or others. While therapy can certainly help with these concerns, that's only part of the picture. The truth is, you can benefit from therapy for any problem, issue, or concern that negatively affects the way you think, feel, or function in your daily life and relationships. So whether you're struggling with anxiety, stress, relationship challenges, low self-esteem, grief, burnout, life transitions, or simply feeling stuck, therapy can provide a safe space to gain insight, develop healthier coping skills, and create meaningful change. One of the most common concerns I hear is, I don't really know how therapy works, or I don't know what I'm supposed to talk about from session to session. Many people worry they'll say too much, not say enough, be judged, or immediately receive a diagnosis. And those fears are completely understandable and valid, especially if you've never been to therapy before. And that's why in this video, I'm providing insight to demystify the therapy process and share practical ways to get the most out of your sessions. So whether you're thinking about starting therapy or you're already seeing a therapist, these tips can help you make your time in therapy more meaningful, productive, and effective. Number 1, come into therapy with a growth mindset. Whether this is your very first therapy session or you've been in therapy before, remind yourself that you're there to learn, grow, and become healthier, not to prove you're right or convince someone that you've done everything perfectly. Growth often requires taking accountability, self-reflection, willingness to change. And sometimes that change involves learning new coping skills. Sometimes it involves changing unhealthy habits. And sometimes it means accepting difficult truths about ourselves. Healing isn't just about identifying what other people have done to you. It's also about recognizing the patterns, beliefs, or behaviors that may be keeping you stuck. And that requires humility, courage, and a willingness to grow. Number 2, be honest and transparent. It's completely normal to feel nervous. Many people walk into therapy feeling anxious, embarrassed, or guarded. You may wonder, will I be judged? Can I trust this person? What if they think I'm crazy? These feelings are common, but remember this, your therapist can only work with the information you provide. If you leave out important details, minimize your struggles, or tell your therapist only what you think they want to hear, it becomes more difficult to accurately assess what's really happening. Therapy isn't about being the perfect client. It's about being authentic. The more you open up and the more honest and transparent you can be, the more accurately your therapist can understand your concerns and develop an effective treatment plan. Number 3, be willing to talk about difficult emotions. One of the biggest misconceptions about therapy is that you'll leave every session feeling better. Sometimes you will, sometimes you won't. Some sessions may actually leave you feeling emotionally exhausted. And why is that? This is because therapy often asks you to revisit painful experiences that you've spent years avoiding. You may cry, you may feel angry, you may grieve, you may experience guilt, shame, fear, disappointment, or even sadness. These emotions don't mean therapy isn't working. In many cases, this means you're finally allowing yourself to process difficult emotions that you've been carrying for a long time. And healing can be uncomfortable before it becomes freeing. Number 4, expect to feel triggered sometimes. There will likely be moments during the therapy process when something your therapist says or something you suddenly realize feels uncomfortable. You may feel defensive. You may feel exposed. You may even want to cancel your next appointment. And that's okay. That's understandable. Being emotionally triggered doesn't automatically mean your therapist did something wrong. Sometimes being triggered simply means you've touched an emotional wound that still needs healing. Growth rarely happens inside our comfort zone. So the key is learning to work through these emotions instead of running from them. And remember, discomfort is often part of the healing process. Number 5, clarify what you want from therapy. Before your appointment, ask yourself, what am I hoping will be different 6 months from now? Be as specific as possible. Instead of saying, I just want to feel better, try saying, I want to reduce my anxiety. I want healthier relationships. I want to stop overthinking. I want to improve my self-esteem. I want to heal from trauma. I want to stop people pleasing. So the more clearly you define your goals, the easier it is for your therapist to tailor treatment specifically to your needs. Specific goals also make it easier to measure progress over time. Number 6, think about what's been happening since your last session. If you're already in therapy, spend a few minutes reflecting before your next appointment. Ask yourself, what went well this week? What was difficult? What situations triggered me? What thoughts kept showing up? Did I practice the coping skills we discussed? And what questions do I have? These reflection questions help make each session more productive. You don't have to remember everything. Some people even keep a therapy journal where they write down triggers, emotions, or questions throughout the week. And number 7, be open to different treatment approaches. Sometimes clients come into therapy expecting only one thing. I just want someone to listen. And while being heard is significantly important, therapy often involves much more. Depending on your needs, your therapist may use, for example, cognitive behavioral therapy or CBT, dialectical behavior therapy or DBT, acceptance and commitment therapy or ACT, trauma-focused interventions, mindfulness techniques, solution-focused therapies, or other evidence-based approaches. Your therapist may also recommend additional resources if needed, and this could include medication evaluation. It could also include group therapy, couples or family therapy, support groups, psychoeducational materials, worksheets, journaling exercises, and coping skill practice between sessions. So remember, therapy doesn't just happen during your 30, 45, or 60-minute session. Most of the growth happens between sessions when you begin applying what you've learned. And number 8, be patient with the process. Some weeks you'll feel like you've made significant progress. Other weeks may feel frustrating. You might take 2 steps forward and 1 step back. This is a normal part of the therapy process. Progress isn't measured by never struggling again. Progress is measured by how differently you respond to life's challenges. Over time, you'll notice you're recovering faster, setting healthier boundaries, managing your emotions more effectively, thinking differently, and becoming the person you've worked so hard to become. So preparing for therapy isn't just about saying the right thing or being the perfect client. It's about showing up, being honest and transparent, willing to learn, open to change, and trusting the process even when it's difficult, because healing takes courage. And every time you choose to show up for yourself, you're taking another step forward towards becoming healthier emotionally, mentally, and relationally. Thanks for watching, and I'll see you in another video.